This is a video version of the participant information sheet for the project Exploring Care Leavers Transitions to Independence, a qualitative study to be published on socialcaretalk.org for prospective care leavers, educators, service providers and policymakers. Young People's Participant Information Sheet. You are being invited to take part in research about leaving care and transitioning to independence. Before you decide whether to take part in this research, it is important that you understand why we are doing this research and what we are asking you to do. Please take as much time as you need to read this carefully and talk to people you trust about it. You are welcome to ask the researchers questions if you have any. Why are we doing this research? Lots of young people leaving care can face problems adjusting to living independently. When a young person leaves the care system, it can be challenging in many aspects of their lives, such as their social, emotional and mental well-being. We want to understand the experiences of care leavers, especially people who come from different backgrounds. We also want to know what matters to young people when they prepare to leave care. We'd like to find ways to improve information, support and services to young people who will leave care. If you give permission to do so, we would like to publish short clips of your video or audio interview, or written transcript of your interview, on a website of people's lived experiences called socialcaretalk.org. To do this, researchers would like to interview 40 care leavers who are aged between 18 and 25 years old. Why have I been invited? You have been invited to take part because you are a care leaver aged 18 to 25 years and you live in England. Do I have to take part? No, it's completely up to you if you would like to take part. If you would like to take part, you will be asked to sign a form saying that you agree to take part in the project. I will give you a copy of the form to keep. It's okay to change your mind, and you could say if you don't want to take part anymore, whenever you like. You don't need to tell me why. Whatever you decide, it will not affect your care or support now or in the future. What is involved if I do take part? If you take part in this project, you will have an interview chat with me. You can choose to have our conversation in a place such as your home or somewhere else you feel comfortable, or it can be online. The conversation between us will be video recorded and or audio recorded, it's up to you. This is so I can refer to the recording or notes later to make sure I get the information correct. We will meet only once and talk for about an hour, with breaks if you need them. I will ask you about your experience leaving care, about pathway planning, your future plans, people who support you, employment, training and/or education, and your thoughts and opinions. I will also ask you about positive and negative experiences about leaving care and how you think the support can be improved. If you would like to chat in your native language, if it is not English, we can try to arrange an interview in your own language. If you would like to take part but would like your identity to be kept private on socialcaretalk.org, we can make other arrangements for you to participate, such as hiring an actor or using a narrator. Please let me know. You can attend the interview with a trusted adult, such as your foster carer, personal advisor, or someone else you feel comfortable with. They will not be able to answer the questions for you, but you may feel more comfortable having them there for support. Choosing how I will appear on Social Care Talk. You will have a choice whether a video, audio or written version of your interview is included, or other arrangements we have agreed to. I will ask you to sign a form entitled Future Use of My Interview. If you sign this form, you give copyright of the interview to the University of Oxford. It is important that you take the time to think about and discuss the copyright form before you sign it. You will be given a copy of this form to keep. You can choose for us to use your real name, first name only, or you can create an alias for yourself. We will create a profile for you with a summary about you and your experiences. If you are recognised on socialcaretalk.org, this would be a little like appearing on the TV. The material on the website is protected by copyright. This means that people are not allowed to copy or record what they find there, but it is possible that members of the public could copy and circulate extracts and images from the website. Are there any benefits or risks from taking part? You will be contributing to research that will be part of the website socialcaretalk.org. The website is accessed by the public, social care and healthcare professionals, social work educators and policymakers who can learn from care leavers in order to improve services and support. Some of the things we talk about can make you feel uncomfortable or emotional. If this happens, we can take a break or stop the interview. I can also give you a list of organisations and resources to support you. Expenses and payments. After the interview, you will receive a £20 shopping voucher as a thank you for your time. What happens if I withdraw after the interview? After an interview has taken place, if you decide you no longer wish to be part of the study, all recordings and typed transcripts of your interview will be removed from the study and destroyed. If you no longer want to be part of the study after the website and audiovisual resources are finished, we will remove your contribution from the website, but it may have already been widely viewed and will remain in my written results as these are published for wider viewing and cannot be changed or destroyed. It is important to remember no personal information about you will be revealed. How will researchers use information about me? We will need to use information from you for this research project. This information will include your name and contact details. Your personal information will be stored on a password-protected spreadsheet. People will use this information to do the research or to make sure the research is being done properly. Your personal information will be kept for 5 years and then deleted. People who do not need to know who you are will not be able to see your name or contact details. Your data will have a code number instead. We will keep all information about you safe and secure so it cannot be accessed by anyone outside of the research team. Once you have finished the study, we will keep some of the data so we can check the results. We will write our reports in a way that no one can work out that you took part in the study. You will be able to choose how you want your interview to appear on the Social Care Talk website. Research documents with personal information, such as consent and copyright forms, will be stored together with the research data, which includes audio and video recordings of the interview and a transcript of the interview, securely in the Medical Sociology and Health Experience Research Group Data Archive at the University of Oxford, Nuffield Department of Primary Healthcare Sciences, for up to 100 years after the end of the study. The Medical Sociology and Health Experience Data Archive is stored on university servers in the department and is only accessible to the project's delivery manager for the Medical Sociology and Health Experience Research Group. Please note that this information will remain identifiable for the duration of our storage. As a reminder, audio and/or video recordings will, with your permission, be uploaded to the socialcaretalk.org website. The University of Oxford is the data controller with respects to your personal data, and as such will determine how your personal data is used in the study. The university will process your data for the purpose of the research outlined above. Research is a task that we perform in the public interest. You can find out more about how we use your information at compliance.admin.ox.ac.uk/individual rights or by contacting the Projects Delivery Manager at ruth.sanders@phc.ox.ac.uk. Your name and contact details will be used to contact you about the research study. Individuals from the University of Oxford may look at your research records to check the accuracy of the research study. The only people at the University of Oxford who will have access to your contact details will be people who need to contact you as part of your participation in the study or audit the data collection process. What are my choices about how my information is used? You can stop being part of the study at any time without giving a reason. We will destroy your data and any collected information will be deleted. If you agree to take part in the study, you will have the option for your research data from this study to be used in future research. If you choose this option on the copyright form, after you've had a chance to inspect the transcript, your research data will be archived in the research team's data archive at the University of Oxford. What happens if I tell the researcher something that concerns them about my well-being? I have a duty to inform the appropriate people if I feel you are at risk or harm, or there is a risk to others from any information you have told me. If I do need to inform anyone outside of my research group, I will speak to you about this. What will happen to the results of the research study? We will create a section on our website called Social Care Talk that aims to help young people who will prepare to leave care and others, such as local authorities, social workers, and social work educators and students. We will write a report, publish our findings, and make presentations to people involved in social care. We will also make the study available to researchers for future research about leaving care after the end of this study. Third-party processors. The interview recording will be typed up word for word by a typist. The typist has signed a form to keep everything you say in the interview confidential. They will type up the interview recording, and once they have finished, the typist will delete their copy of the recording and typed file. The file will be password protected. Who do I contact if I have a concern about the research or I wish to complain? If you have a concern about any aspect of this research, please contact Suzanne Eden on 07767 0755 0196 or suzanne.eden@phc.ox.ac.uk or Susie Blund on 01865 289 302 or sue.zblund@phc.ox.ac.uk, and we will do our best to answer your query. We will acknowledge your concern within 10 working days and give you an indication of how it will be dealt with. If you remain unhappy or wish to make a formal complaint, please contact the Chair of the Medical Science Interdivisional Research Ethics Committee at the University of Oxford, who will seek to resolve the matter as soon as possible. Email ethics@medsci.ox.ac.uk or write to Research Services, University of Oxford, Boundary Brook House, Churchill Drive, Hennington, Oxford, OX3 7GB. How have the public been involved in this study? Public contributors who are care leavers have been involved in the research design, and one of them will continue to be involved throughout the study. We have also a care leavers advisory panel, including 4 public members who advise our research study. Who is organising and funding the study? This study is funded by the National Institute of Health and Care Research, NIHR, School of Social Care Research, Research Patient Benefit Programme, NIHR 204258. Who has reviewed the study? This research has received ethics approval from a subcommittee of the University of Oxford Central University Research Ethics Committee. ethics reference R79689/RE001 to respond to this invitation. If you're interested in taking part in a research interview or have any questions, please contact Anya Kelly or Ala Syria at the University of Oxford on +44 01865 289 414 or Social Care Talk Care Levers at phc.ox.ac.uk or by post at Medical Sociology and Health Experience Research Group, Nuffield Department of Primary Care Health Sciences, University of Oxford, Radcliffe Observatory Quarter, Woodstock Road, Oxford, OX2 6GG. If you would like to discuss the research with someone beforehand, or if you have any questions afterwards, please contact Anya Kelly or Ala Syria, Nuffield Department of Primary Healthcare Sciences, University of Oxford, Radcliffe Observatory Quarter, Woodstock Road, Oxford, OX2 6GG. Telephone +44 01865 289 414 or email socialcaretalkcarelevers@phc.ox.ac.uk. Thank you.